All right, we're recording now. Hi, I'm sitting here with Kristen Walker. She's a patient of ours. And Kristen, you were very happy with the results that you had with your treatment.
Absolutely.
I want you to tell us what was going on when you first started.
Initially what had happened is I had some pain in my shoulder, and I had an MRI done, and the doctor had told me that I had degenerative deterioration and that I possibly needed to have surgery. And then I also had some lower back pain at the time, and I had had some surgery in the past on that. And I happened to be introduced to you and made an appointment to come in and sit down and talk to you, and that's how it all started.
Yeah, now with your course of treatment, one thing you didn't really mention was just how much pain you were in when you started.
Oh, I could hardly move my arm. I couldn't do the normal things with my arm. I definitely am not one that likes to think about going through surgery, but I was definitely on the verge of making that phone call and scheduling that appointment. That's how much pain I was in.
Yeah, I remember you were saying like you couldn't lift your children.
Oh, absolutely.
Couldn't open the door, couldn't carry groceries. It was pretty bad. And how old are you?
I am 42.
Thank you. He's honest. He's honest. But also now that you've, we're nearing the end of your stabilization phase, where we've done your exercises. You consulted with another doctor, and what did he tell you?
When I consulted with the other doctor, as far as after my physical therapy,
Yes.
that I'm good. I'm feeling
That you no
great.
longer need the
Yes,
surgery.
no.
Exactly. And
No, because the physical therapy, and I can feel this, is definitely building up the strength around there, as you were able to see in the MRI and determine a course that's going to strengthen the muscle in there. And so I've been real faithful. At first I wasn't, and so you do need to be faithful on the physical therapy part of it. But once I did really commit to it and start doing it, I've seen a huge improvement on the strength.
good. Yeah, and one thing I always emphasize to my patients and to everyone is that with minimal effort, you get minimal results.
Absolutely.
With maximum effort, you get maximum results, and that's extremely true in your case. It's not always 100% true. You know, sometimes you put minimal effort in, you get good results. Sometimes you put maximum effort in, you get minimal results. But it's as long as you're working forward on the problem in a constructive way, you're going to make progress. So that's really cool.
Well, what had impressed me was initially when you had given me my routine for my physical therapy, you at that point hadn't seen my MRI results, so I did that physical therapy routine you had set up for me. I finally got my MRI documents over here to you to look at, and then you changed my physical therapy routine, and just with that slight change, it was like night and day improvement.
Yeah.
So that was...
So how much difficulty do you have doing your jobs, playing with your kids, carrying groceries now?
I feel great.
Yeah.
I'm a lot more active than I was when I came in the door. Absolutely.
And
Huge
that's
improvement.
our big goal. It's important to relieve people's pain, but also to improve your quality of life and your functional ability, because the ramifications, if you would have had a poor surgical outcome, could have been permanent. So that's one thing that we always strive for with our patients. I just want to thank you for taking this time to share this experience with other patients that might be thinking about coming in to get looked at here. Thank you.
Absolutely. Thank you.